Hello, and welcome to my monthly Focus On. And this month I'm focusing on CT and also what happens in this department, the radiology department. I'm in the CT scanner room at the moment, so it can be a bit noisy, so you'll have to forgive us. But I would like to introduce you to Jenny, and Jenny is the lead CT radiographer. And I just want you to explain what a CT scanner is and what does it do, because I know over the years that technology like this has enabled us to actually change the way we practice from a medical perspective, and it has had huge benefits. But I know that we're trying to actually save and develop our charity to enable us to buy a further CT scanner. But I really just want you to perhaps explain what one is.
Okay, so a CT scanner is an imaging modality that allows us to take cross-sectional imaging through the body. We do a variety of patients. We do inpatients, outpatients, trauma, and it allows us to do 2D and 3D imaging of the body, which helps clinicians make diagnosis and also aids treatment decisions. So we have a lot of patients that come through our scanners, ranging from cancer patients, trauma patients, orthopaedic patients. So it's a lot of patients in the hospital will come for a CT scan at some point in their pathway.
So this piece of equipment is being used all the time, and the demand is growing.
It is indeed. We use our scanner all the time. We have a 24/7 service. The demand is definitely growing. The workload's growing. So in mention to the raising money of the charity, it would be brilliant if we could have a second scanner to cope with the workload, but also to be able to offer our own Tameside patients their examinations in Tameside rather than sending them out to neighbouring hospitals. So that would be brilliant.
And it'd be really helpful as well, in the sense not just about an early diagnosis, which is really, really important to make sure we create a treatment plan for the patient early on in their pathway of care. But if we do that, also we're reducing their length of stay in hospital if it's for an inpatient.
Yeah, definitely. We'll be able to offer more inpatient slots to get patients outside of the hospital again rather than being inside just waiting for imaging. And we also help with the imaging pathway and help with diagnosis a lot quicker.
So, Jess, you're working in the CT department, aren't you? You're one of our specialist radiographers.
Yeah.
So I know you understand the importance of replacing our CT scanner. So could you just tell us about the benefits of doing that?
So the benefits will include we'll be able to scan a much wider range of patients, so we'll be able to do more vascular patients, which the current scanner unfortunately isn't quick enough to perform. It can scan basic things, but accident emergency patients that are coming in with ruptured aortas, other vascular issues we're unable to scan. Also, we do a lot of pre-operative imaging. Unfortunately, the scanner isn't able to keep up with that demand, so we would be able to perform those, meaning patients would, get put through the hospital quicker, and also they wouldn't need to be transferred somewhere else to have their treatment and their diagnosis as well. So it would be fantastic to have a new scanner, because it means that Tameside patients would be scanned at Tameside.
Yeah, and that's really, really important for the patient themselves, because they'll get an earlier diagnosis and then we can agree a treatment plan earlier in their pathway of care. So it's really, really important. And as you say, technology is always advancing all the time, isn't it?
Yes.
So it'll allow you to do a lot more through a new CT scanner. Hello, Matthew. You're a lead radiographer here, working in the CT scanning facility. And I know that obviously we're trying to raise funding for a new CT scanner, but could you tell me a little bit about the benefits to the patients of a new scanner?
Yeah, so CT is kind of one of the heart of the hospital. A lot of patients will come through CT at some point in the year, if not in their lifetimes. We scan around 20,000 patients a year within our CT department. So, it's quite a lot of throughput of the department, so a new scanner will enable us to potentially do those 20,000 patients a little bit quicker, with a better image quality, hopefully improving their overall experience, and ultimately their diagnosis will be improved and quicker.
Right. And I know that we are fundraising at the moment and the community are getting involved, but we've got a history here, haven't we, of fundraising for a CT scanner?
Yeah, we have. So our first CT scanner was installed about 25, 30 years ago. Had significant support from Mandy Turner and her family. So the community have got behind us once before, so we'll be asking them again to try and do everything they can to help us out, and any little that they can do, pounds, pence, everything will be, you know, gratefully received.
Yeah, and really we want to raise £1 million, don't we? And hopefully we'll be able to do that over the next 12 to 18 months, but it will make a real difference.
Oh yeah, it will. It will be an unbelievable difference. I mean, £1 million sounds like a lot of money, but when you look at the benefits that it will bring to the community, it'll be a wide investment moving forward.